Yeah, perhaps to introduce ourselves. My name is Kurt Sattelkar. I'm pathologist by training, working here at the Medical University of Graz, and here I'm in charge of the Diagnostic and Research Center for Molecular Biomedicine.
And my name is Heimer Müller, also working at Medical University Graz, doing a lot of research in AI and explainability of AI. And Kurt, what I realized that a series of our paper about colon cancer have now really high citations. Do you know what was the history when we started with the CRC cohort?
Yeah, actually this cohort in colorectal cancer built on patient care. We are here a member of a huge university hospital, and the Institute of Pathology is taking care of the pathology diagnostics. Means we preserve the tissues, we make the diagnosis. And the strength was that on the one hand, we oversee more than 12,000 patients. We have the biosamples, but we also have patient data and outcome data. The problem is, if you just have this material from the healthcare, it's not usable for doing research and innovation. And you have to clarify many issues. How can you use it? What's the legal status? What's the ethical clearance? Many people have already died. What is the consent? How you get ethics approval? And then you have to clear your data. Because data were produced over almost 3 decades. They have different quality, they have different structure. So it's a huge effort making such a resource out of the healthcare available for research and innovation. And this we have done over the past in the Austrian Genome Program in context of BBMRI-ERIC. So the resource was there, but now the question is how to make it usable for research and what kind of research you can do on this resource.
And this makes us happy, the computer scientists, because we now got this big amount of data. We developed some nice algorithms, and we really had some nice finding, and we found some new biomarkers in this AI algorithms we developed. And even then we have done some validation study together with Italian colleagues from BBMRI Italy. And I think that there is really something coming out of this which will have patients in the future. So definitely, Kurt, what do you see is the significance in terms of enabling this stuff then for patients?
Yeah, I think one of the great opportunities that emerged was the increasing relevance of using AI in medical diagnostics. And particularly in imaging, AI already is very widely used in healthcare. And here we really had first to digitize the histological slides, to make them accessible for training an algorithm. So we had to build up high capacity digitalization capacities. And then we could also follow new ways how to train an algorithm. Classically, you train an algorithm in that an expert indicates what feature is linked to a certain disease, diagnosis or outcome. In this case, we just had the whole information of the image and the outcome. And this allowed us, I think it was for the real first time, to show that without any specific annotation, an algorithm can identify features that have a strong predictive value for the outcome of a disease. And now the big question is, what does the algorithm recognize? And here the explainability comes into play. And what was interesting is the features that were associated with a good or poor patient outcome all looked very similar to the human. But it was not clear, do we really see the same feature like an algorithm? So we tested this in another study we have done with Milano, where just we showed people, look at this feature and can you identify high-risk patients? And actually it worked. So what we on the one hand could show that obviously the feature we see as a human has the same statistical relevance like the feature recognized by the algorithm. And at the same time, it's a first example that not the expert trained the algorithm, but actually the opposite way. An algorithm trained the expert who now can use a conventional microscope to improve patient outcome and diagnosis.
So pathologists can learn from us, from computer scientists.
Right.
And then finally the patient gets a better treatment?
At least you can better predict outcome, and if you know there is a poor outcome, a poor prognosis, this patient would need additional therapy. And it also could help, let's say, if you do a clinical trial, to better stratify your patients, because this different outcome creates a huge background noise in your data of a clinical trial, which could undermine the significance and the performance of any new therapy.
Cool. And can we already buy it?
No.
What's next?
Yeah, it's not yet an industrial product. Even we did it together with Google, because we were relying on the high computing capacity, which we did not have in the university. But at the moment, it is not taken up by a company that develops a product. So essentially what we did, it's some proof of concept that this approach may lead to very interesting new products that may benefit patients.
Cool. I'm really waiting that I will see this in reality. Things we developed some years ago with some first experiments seem to be arrive in the clinics. What do you expect in 2 years, in 5 years?
No, I think we are now in this transition phase, and we see a series of new products coming, but there is a challenge on the regulatory side. Because if you apply an algorithm making medical diagnosis, you have to comply with the regulatory requirements. In Europe, it's IVDR. In US, it's FDA. And we are still lacking guidance how such innovative tools comply with these requirements, which were designed not for AI, they were designed for laboratory tests. And so there is some challenge, how you demonstrate performance, how you demonstrate robustness of your algorithm to be used widely in the healthcare.
But I think for this challenge, our reference data set can help. If somebody comes and he wants to validate his algorithm, we have the test data sets ready to show his performance in these different areas from IVDR. And I think that's also something we developed together with this German Empire project, where we act now as a reference center and can use the CRC-Cohort as a test and reference data set for others, for external partners.
Yeah. Absolutely. And that's the beauty of having, let's say, digital information. It can be easily reused. A biosample is used up when you do an analysis, but the data you can share, you can reuse for different projects and programs. And also one of the big lessons learned is typically you need a specific research program to generate high quality data that then can be reused. That's not, you cannot prepare it for all scientific questions. It's not feasible. You always need a specific goal in mind, a specific problem you want to solve, and then you can reuse it for many other projects. Therefore, also, I would say this principle, the fair data, is so important, because then the next investment goes to the next step. Otherwise, we always start from the same point. And now we have done the basic funding, the basic homework on which we can easily add a series of new projects and questions.
But what we also need is this famous trusted environment to put the data in, because they cannot live somewhere. They have to be in a secure environment. And I think BBMRI provides such a trusted environment for these high-value data sets. And in addition to this trusted environment, if we then can, say, connect computing, then we can again make next step and extract new knowledge out of these data sets.
No, that's absolutely important, because at the end we are dealing with patient data. So therefore, if we want to use this for research, we have to try to anonymize data whenever possible, which, by the way, is doable when we talk about digital images of a histological slide. So we did some specific studies to show to what extent this kind of data can be anonymized. But genetic data, it's much more difficult, or at least we have to minimize the risk. It's about risk mitigation. It's never zero risk. And it's also important in communicating this to people. But you always have to balance what's the risk, what's the benefit. And also you have to take all the measures on the technical side to prevent the data is misused or patients are identified, because that's I would say, the risk that is that you identify patients and this information may be used against the interest of a patient. Therefore, privacy and cybersecurity are key elements you have to build up in a modern biobank concept.